last 8 months, so what you're about to see could change your life. The following documentary was made with the help of doctors and medical scientists, but that won't stop YouTube, Facebook, and all the other tech giants from censoring it. In fact, as soon as this is uploaded online, it will almost certainly be taken down and covered up for one simple reason. They don't want you to know the truth. But that doesn't matter because One American News is committed to exposing the truth wherever we find it. That's what journalism is. This program could be the most important 28 minutes of your life, and in fact, it could even save your life or the lives of your friends and family, and it's no conspiracy either. This information comes directly from doctors and healthcare workers, as well as the Centers for Disease Control, the CDC. We'll show you where you can find and verify this information right from the CDC's website yourself. And after watching this report, you'll discover that this lockdown and the hysteria over the pandemic is one of the biggest lies perpetrated on the American people in the history of our nation.
8 months. That's how long the United States has been in lockdown. As of the end of October, 8 long months. And listening to the people in charge, there's no end in sight. Democrats and the mainstream media insist that the coronavirus is the new bubonic plague and that Americans will simply drop dead if they set foot inside a business or dare to leave their homes without their masks on. Unless you're Nancy Pelosi or Anthony Fauci or Gavin Newsom or Lori Lightfoot or millions of Black Lives Matter terrorists and looters. So then, what truth is there to these bold assumptions made by our courageous leaders in Washington? One American News has been investigating this pandemic since it began. And after talking with doctors, medical scientists, and healthcare professionals, we can find absolutely no reason why the lockdown should go on even 1 day longer. Our businesses are ready. Our doctors are ready. Our workers are ready. It's time for the lockdown to end, and it's time for America to open up for business today. Back in March, when the lockdowns were first set in motion, they were based on the idea that the coronavirus was a new deadly pathogen that would kill millions of Americans. But as the months have gone by and we've had more time to study the virus, we've learned that's simply not the case. I spoke with Dr. Brian Tyson, a medical doctor who owns and operates a clinic in Imperial Valley, California, one of the COVID hotspots in the state. Dr. Tyson has successfully treated and cured some 2,000 coronavirus patients at his clinic and says the media is making the virus seem like a much bigger problem than it really is.
Yes, there are subpopulations that do have a hard time with it, but for the most part, it's not that bad, especially for those under the age of 40.
For evidence, we need look no further than the Centers for Disease Control itself, which is continually updating their website with the latest data on deaths attributed to the coronavirus. As of October 28th, 2020, there are some 230,000 deaths which are being blamed on the coronavirus. Well, let's take a closer look at those numbers and break them down, because when you do, something very interesting happens. By looking at this chart, and don't take our word for it, this is from the CDC itself, which you can see right here. We can see that, yet again, COVID-19 is rarely the actual cause of death among coronavirus patients. According to the CDC themselves, of the 230,000 deaths attributed to coronavirus, a huge number of them died from other causes, such as pneumonia and influenza.
88,000 had a diagnosis of influenza and pneumonia, including COVID-19. So did they die of influenza? Or did they die of COVID-19? Or did they die of pneumonia?
Another 19,000 died from chronic respiratory diseases. Chronic meaning conditions they had their entire lives and had nothing to do with coronavirus. 46,000 patients died from hypertensive diseases. 24,000 died from heart disease, and a whopping 40,000 people died from cardiac arrest and heart failure. Heart attacks, in other words. Yet all of these, even patients who died from strokes, were marked down as dying from the coronavirus. Doctors who spoke with One America News explained that over 130,000 patients who are being considered COVID-19 deaths already had life-ending diseases, including cancer, dementia, Alzheimer's, kidney failure, and obesity. However, most astonishingly of all, the CDC even counted over 7,000 patients who died from self-inflicted injuries, poisoning themselves, and even, tragically, suicides. Yes, people who killed themselves were marked down as dying from coronavirus. According to Los Angeles County public health officials, they admit that anyone who tests positive for coronavirus from the last 90 days and dies from anything, including heart attack or stroke, is counted as a COVID-19 death. They also acknowledge that this method, quote, could end up including some people who would have died even if they were not infected. And in Oregon, state public health officials said they count all deaths from anyone who tested positive in the last 60 days as dying due to the coronavirus. They said that even includes people who die in accidents such as a car crash. So someone who got coronavirus months ago recovered and now they're driving along in their car to go to the grocery store when suddenly they crash into a tree and are killed by coronavirus. Following the CDC's current guidance, doctors only need to believe a patient died from COVID-19. No test required to mark coronavirus down as the cause of death. So we're not operating using science anymore. We're operating on a system of beliefs and faith. This is turning into a religion. Doctors also tell One America News that the CARES Act, passed by Congress in March, gives hospitals an additional 20% bonus for coronavirus diagnosis on their DRG, or diagnosis-related group, which is paid for by Medicare.
The CARES Act that Congress passed, if you added COVID-19 to the hospital death record, okay, then you got a 20% bump in the DRG. We know that. So if you died of a heart attack, and you died of pneumonia, or you died of a stroke, and we added that because it was a possibility because you had respiratory problems, but we couldn't test for it, so we really didn't know. But if we put those on there, then the reimbursement for the hospitals went up.
Essentially, that means doctors are being paid to list deaths as coronavirus without any indication that the patient's death was actually COVID-related. Furthermore, hospitals are being allowed to use presumed diagnosis for COVID death, which doctors tell us means that hospitals basically just guess if a patient has coronavirus and leave it at that. How many of those guesses are entirely wrong? And how many of those guesses earn the hospitals another 20% bonus from Medicare? The CDC backs these numbers up, actually explaining that the coronavirus itself is responsible for barely any of the deaths listed as coronavirus related. In fact, the CDC admitted in August that the coronavirus was the cause of death in just 6% of patients. The other 94% of coronavirus deaths are due to all those pre-existing conditions we just covered, cancer and heart attacks and so on. 94%. The CDC explained that nearly all of the people who have died from the coronavirus suffered from other serious illnesses and were also very old. If we add those percentages up, that means that of the 230 some odd thousand deaths attributed to coronavirus, just 13,000 of them died from the virus itself. The other 217,000 people died from other serious illnesses they already had. So unless you're an elderly person who has major health problems, the chances of dying from the coronavirus are extremely low. According to their own estimates, the Centers for Disease Control say that for children and teens up to 19 years old, your chances of surviving the coronavirus are 99.997%. And you might say, well, we know children and teens do well, that's no surprise. Okay, well, how about this? From age 20 all the way up to 49 years old, you have a 99.98% chance of recovering from the coronavirus with no problems. And for that critical at-risk population, those from 50 to 69 years old, you have a better than 99.5% chance of beating the coronavirus. With odds like that, who needs a vaccine?
We do not need a vaccine to open this country. We don't. Simply, plain and simple, we don't. All of the evidence shows you have a 99.997% chance of survival. If that's your chance of survival, what do you need a vaccine for?
More importantly, with odds like that, why are we still locked down? There's mounting evidence showing the lockdown is dramatically more harmful to the American public than the coronavirus ever was. Doctors explain that deaths due to unreported illnesses are skyrocketing, all because people are too terrified to go to the doctor and get help. People are avoiding cancer screenings, checkups on their hearts that would have prevented heart attacks, and other major diseases are going untreated thanks to the fear-mongering in the media.
Politicians are interfering with physicians such as myself by limiting what physicians can use to take care of sick patients. They're allowing people to die basing policies on information that's not scientifically proven. We do know early treatment works, and withholding that early treatment is probably one of the biggest crimes against humanity that we've seen in our nation.
The lockdown is having serious consequences on mental health as well. A new survey reveals young Americans are suffering tremendous levels of stress during the lockdown. According to the American Psychological Association, their Stress in America report revealed that Gen Z, Americans aged 18 to 23, has the highest level of stress of any age group in the nation. A staggering 71% of Generation Z Americans said they felt miserable and unhappy, while 81% of 13 to 18-year-olds said they were suffering negative consequences from the lockdown and school closures. The authors of the study said we're on the verge of a national health crisis, and it shows. Suicides and despair deaths are up dramatically around the country, and in one Wisconsin county alone, youth suicides spiked by a shocking 90%.
So the lockdown is worse than coronavirus. Look at all the unintentional deaths now. Cancer treatment, patients aren't getting cancer treatment. Heart attacks, high blood pressure, stroke, suicide, mental illness, drug abuse, child abuse,
Domestic abuse, yeah.
domestic abuse. Look at what's going on in society. Kids, hanging themselves in closets because there's no outlet for them.
Doctors warn that the oppressive steps taken by states like California to lock down their residents has had devastating effects on mental health. A national survey backed that up and found that in just the last month, a staggering 5,000 Americans are so miserable they've considered taking their own lives. I spoke with Dr. George Fareed, a family medicine specialist who's been treating patients in Brawley, California for over half a century. He explained the lockdown was having severe consequences on the patients in his community.
I think that it's hurting public health. We need to open up. We need schools to be functioning again, and we can take steps to treat people that might be vulnerable to COVID-19 if they don't receive a treatment. We need to get back to a normal society, and there are major problems of lockdown and of economic hardships and psychological hardships as a consequence of lockdown.
And the most tragic, senseless fact of all is that none of this is necessary. Everything, the virus, the economic upheaval, the draconian lockdowns, the suicides, they all could have been avoided, still could be avoided, because of one simple fact. We have a cure. It's a medicine that's been banned by entire countries, including France, Belgium, and Italy. The World Health Organization has suspended trials involving the drug because they say it's just too dangerous. And the political elite and the mainstream media are issuing sensational warnings, claiming it will kill you.
It will kill you. I cannot stress enough. This will kill you.
So what is this mysterious, dangerous drug, and why is the world having a meltdown over its use? The drug is called hydroxychloroquine, and contrary to pretty much everything you've heard in the media, it's been safely used for nearly a century by over 100 million people all over the world.
It didn't make any sense to me that hydroxychloroquine was getting the bad rap that it was when we give over 1 billion prescriptions of this drug a year worldwide. You know, the safety profile is extremely well known.
And has been for 65
It
years.
has for 65 years, and I think there's only been 20 documented cases in 65 years that this is a bad drug, that they had an adverse reaction to it.
And all it took to turn the mainstream media and radical leftists in Washington against it was one little recommendation from the President of the United States.
Nothing will stand in our way as we pursue any avenue to find what best works against this horrible virus. Now, a drug called chloroquine. Now, this is a common malaria drug. It's also a drug used for strong arthritis. It is known as a malaria drug, and it's been around for a long time, and it's very powerful.
After that, the media and the radical left knew they were against it, no matter how many people it might have saved, and they began rabidly accusing President Trump of endangering Americans' lives.
The entirety of the media was dead set against anyone ever talking about this simply because the president expressed optimism in
That's
its
not
role
why,
as a
it's because it
treatment.
kills people.
The thing is, though, none of that is true. Hydroxychloroquine isn't dangerous at all. Doctors prescribe it to tens of thousands of patients every year for conditions like rheumatoid arthritis and lupus.
We've been using hydroxychloroquine for years. This drug came out in 1955. I've been using it in my practice for over 10 years. This drug is also listed on the WHO list of essential medicines of the world. And it's never been a problem until now.
I've been prescribing hydroxychloroquine for years and years, and I've been in practice for 50 years as a physician, and it's been very safe. I've never had complications with hydroxychloroquine.
Countries like France, China, Australia, Italy, South Korea, and even Algeria and Turkey have all treated thousands of patients with hydroxychloroquine, and as a result, have a much lower fatality rate than the United States. So 230,000 people have died from this. How many could we have saved if we had been using early treatments of hydroxychloroquine?
We could have saved well over 100,000 people, and probably closer to 150,000 lives could have been saved.
If we would have been able to use the triple treatment from the very beginning, we easily could have saved another 80 to 85% of those. That means that instead of 220,000, maybe we lose 20 or 30,000. Politics is getting in the way of medicine and people are dying. And it's time for Americans to wake up and tell the politicians to stay the hell away from our healthcare.
In Africa, where many countries are already taking hydroxychloroquine prophylactically for malaria, case numbers for coronavirus are shockingly low. For example, South Africa has a total of 720,000 cases of coronavirus and just 19,000 deaths, compared to the 230,000 here in the United States. Uganda is another good example. With a population of 45 million people, they've had just over 100 deaths. 100 deaths out of 45 million people practicing no social distancing whatsoever.
I've treated in my clinic in Raleigh with other providers about 300 to 400 patients, probably
Wow.
closer to 400. And they've been very symptomatic patients in many cases, and they all uniformly show a dramatic improvement within 24 to 48 hours if they're treated in this early window.
But none of that matters to politicians and the media because it means the lockdowns aren't necessary. In May, The Lancet, one of the world's leading medical journals, published a study that claimed taking hydroxychloroquine significantly increased your chances of death. But there was a major problem. The prestigious study from Lancet was totally bogus. It was so full of errors that just a few weeks later, the study's own authors were forced to retract the entire thing and admit their testing methods were deeply flawed.
There's no research study out there that says hydroxychloroquine is bad. The one study got pulled. It got retracted. It was false. They falsified data. And they still are running with that falsified data to say hydroxychloroquine is bad. It's not bad. We know it's not bad.
But by the time they retracted the study, the damage to hydroxychloroquine's reputation was done. People were too frightened to even participate in trials, and local officials, from governors to city mayors, did everything they could to ban its use. Which means all the lives that could have been saved by taking it are entirely on their heads. So, when you use this cocktail of drugs, what kind of success rate do you see?
I see about a 99.8% success rate or 100% success rate if it's used within the first 5 to 7 days.
100% success rate
In my experience,
curing
yes.
the coronavirus.
Yeah, yes, absolutely. This should have been the model for what it was done, could have been done, and should have been done throughout our country.
As a result of these undeniable successes, tens of thousands of doctors are coming out in support of the medication. Some 44,000 doctors and medical scientists worldwide have joined together and signed a new document calling for an immediate end to the pandemic lockdowns. The effort, known as the Great Barrington Declaration, is being spearheaded by doctors from Harvard, Stanford, and Oxford universities. These doctors say they have grave concerns about the damaging physical and mental health impacts of the COVID-19 policies, which have had tremendously negative consequences on public well-being. Can hydroxychloroquine save lives?
Hydroxychloroquine can save lives. Hydroxychloroquine has saved lives, especially here. There is absolutely no reason to not use a proven therapeutic. We know that it works. We've proven that it works. And again, now over 150 studies has shown that it works. Why we can't use it, or why people still don't want to use it, it's beyond me. It makes no sense.
Hydroxychloroquine can definitely save lives when used properly. I've treated many patients with this medication, and the treatment has been very effective. They show dramatic response improvements and are relieved that they are getting something that can prevent them from going to the hospital. It works 100%.
Dr. Tyson, along with all the other doctors who have recommended hydroxychloroquine, are backed up by some very powerful supporters. Coronavirus survivors. Countless patients who have come down with the coronavirus and then gone on to defeat it say they owe their lives to hydroxychloroquine. But you don't have to believe us. Just listen to them tell their own stories. I spoke with Eddie Galindo, a coronavirus survivor who wouldn't be alive today had he not taken hydroxychloroquine.
At one point, I had to go to the hospital because I couldn't breathe at all. And I believe, the hydroxychloroquine is really what made a big difference.
That's when you notice things turn around.
Yeah, I started getting better progressively, and here I am today. I'm off oxygen, feeling so much better. If I hadn't taken hydroxychloroquine, who knows what would have happened. I might have not been here today.
Countless other survivors across the nation tell a similar story.
If you've got the virus, if you're afraid of getting the virus, the only thing I want you to know is there is something out there that can save you. It must be issued in the correct dosage, but it can save your life. Ask for it. Make sure your doctors know you want to try the hydroxychloroquine because it saved my life.
And I thank God that the President of the United States mentioned that drug because it did save me. I mean, let's just put politics aside. Right now, let's just be human beings and put politics aside. And let me just say that the person who's in office right now, the President of the United States, I give credit where credit is due.
The gasping for air stopped. My vitals were improving. Just overall, I had pretty much a 180-degree turn. It was incredible. In fact, I was in tears. And I really think that, the American people can have hope that we have something that can help people, that can save lives and put an end to that suffering.
Friday I got better. Saturday I got better. Sunday I almost felt like my old self. So that drug is really what saved my life, to be honest with you.
But despite having effective, affordable and widely available treatments, one of the biggest problems is that the government is recommending against any treatments until patients are already suffering from life-threatening symptoms. I know that sounds crazy, but these are the official guidelines from the National Institutes of Health. Right here on their website, they specifically say they recommend patients with coronavirus don't get any treatments unless they're already hospitalized and require oxygen to survive. That means hospitals are forcing patients to wait for care until the last stages of the disease when their symptoms are so severe their lives are in danger. So right now they're basically recommending against treating people when it would be most effective.
Yeah, exactly, and that's heartbreaking. And I think that we would have had a handle on this pandemic well before this time. It's continuing on tragically.
Can you imagine any other scenario where it would be acceptable for a doctor to recommend against medical treatment until a patient was dying?
Why would I say, hey, you know what? You have pneumonia. We want you to stay home for 10 days, and we're not going to give you antibiotics until you need to be put in the hospital. Does that make any sense? No. Well, we can't take that approach with COVID. We know that if you treat it early, you can have a good success rate. We've shown that success rate. You know, almost 2,000 patients now we've treated, and not one mortality. Okay? That speaks for itself. So why the NIH is making those recommendations, that's one of the biggest malpractice statements in modern medicine history.
While we're waiting for herd immunity, it's critical that we don't give in to herd mentality. It's time for America to reopen. Americans need to get back to work and get back to their lives today. Not tomorrow, not 6 months from now, today. I spoke with a number of business owners from across Imperial Valley who have seen not only their businesses, but their entire communities devastated. Not by the coronavirus, but by the lockdowns.
I believe the lockdown is causing more harm than the coronavirus. Why are they keeping us locked down? When they're still working, they're still going and getting their checks, but it's affecting us. We got to move forward. We need to succeed. We want to make our money and be able to survive.
This lockdown has done way more harm than good. This 2-week lockdown. You know, we're supposed to be closed down for 2 weeks. You know, to slow the spread, blah, blah, blah. It's nonsense. This has not helped slow the spread.
Should we open up America today?
We should open up America today. This is nonsense. We need to get opened up. People need to get back to work. People need to get their psychological stability back. We got to get this thing opened up.
This lockdown is causing more harm than the coronavirus.
For sure.
I'd say we definitely need to open up now, today. Not tomorrow, not the next day, but we need to open up now.
We have the tools we need to fight this virus. We've had them the whole time. Rather than sit back for another year and watch countless more businesses fail and millions more Americans suffer and struggle to put food on their table, we need to take action. This virus isn't a threat to 99.97% of the population. And for those who are endangered, there are proven effective treatments available right now that can stop the virus dead in its tracks. So before any more lives are needlessly lost, let's do what needs to be done. Let's take the necessary steps, and let's get America back on the road to prosperity. For One America News, I'm Pearson Sharp.